And it is so great to have all of you join us for this webinar this morning, looking at the issue of HIV/AIDS and faith, particularly as it relates to Black communities. As Noah said, I am Fred Davie, Reverend Fred Davie, and I serve as a senior advisor for racial equity at IFYC. And I am so pleased that we can be in partnership with Wake Forest Divinity School's Compass Gilead Faith Project on HIV and AIDS. We're also very pleased to have partnerships with HBCUs, historically Black colleges and universities, as well as HSIs, historically Hispanic serving institutions across the South. Through grants that we have made to them to advance the destigmatization of HIV and AIDS on their campuses and in their local communities. We know that faith traditions have not always been the most forward-looking and forward-thinking when it comes to issues of HIV and AIDS and human sexuality. But what we want to do today is to try to focus on the positive ways in which Black faith communities can help to destigmatize issues of HIV/AIDS and human sexuality. And we have a great panel here this morning who is going to help us in our conversations, help us as we talk about and come to understand better how we can make healthy choices about our lives, destigmatize issues of HIV and AIDS and human sexuality, and do it from a perspective of faith, how we can reach into our faith traditions and embrace the best of those traditions to address this issue that continues to confront our community. So what we're going to do is ask our panelists to introduce themselves and to talk just briefly initially about ways in which their work and their careers intersect with the issue of faith, HIV and AIDS. And then we'll have some questions for them to continue the conversation. And we'll ask you, I think as Noah has, the audience to use the chat function to ask questions and make comments. And then if possible, at the end of our conversation, we'll try to put some of those questions before our panelists. So let me start with Reverend Dr. Valerie Bridgeman to ask her to introduce herself, followed by Khadijah Abdullah. And then after Khadijah, we'll have Dr. Ulysses W. Burley III. So Dr. B or Dr. Bridgeman, and then Khadijah, and then Ulysses. Please go ahead.
Hey, everyone. I'm Dr. Valerie, Dr. V. I am a woman of a certain age, so you'll hear them referred to me as a doctor. I'm actually in my 60s and a woman of the South, so this work is important to me. So I deeply appreciate the opportunity to be in this conversation. I am the CEO and founding president of Woman Preach, which is an organization that brings preachers to full prophetic voice. I'm also the Dean and Vice President of Academic Affairs at Methodist Theological School in Ohio. But I grew up in Central Alabama and in a holiness congregation, Holiness and Baptist congregation. My interest in this conversation began in 1989. Why I know that date so fully is because it was when I was a chaplain in a hospital and got called to serve a young man who was in emotional distress at 2 a.m. in the morning crying because at that point he felt completely abandoned by his family, by his community, and by his church. And I vowed that day that if I was going to go to hell for loving people, that would be a good reason to go to hell. And so this conversation has been ongoing and really important to me since 1989.
Thank you. My name is Khadijah Abdullah. I'm based here in DC area. I am the founder of Rahma, which means mercy in Arabic. And the goal of Rahma was to kind of do education in the Muslim community. But over the years, we have kind of expanded and do faith work in diverse faith communities. I started in this field when I was an undergrad. I met a Muslim man living with AIDS. I worked in the hospital part-time. And it's the first time I kind of had this experience. And, he told me the stigma he faced with his own faith community. And it really bothered me. And I realized I didn't have much experience on HIV or AIDS. So it kind of motivated me to kind of do work on my campus. And I founded Rahma when I was an undergrad. And now I've been doing that. And then some years later, we started Dr. UB here, or Ulysses Burley, professional name here on this webinar. We started Faith HIV AIDS Awareness Day. And the goal was to bring together faith communities across the US and even beyond to kind of come together one day each year to address stigma, raise awareness. We work with people from the Muslim community, Christian, Jewish, Baha'i, Buddhist, Sikh, Hindu, and other spirituality as well. And I also work at Tutors National. I'm actually here right now. I work with youth and HIV prevention education, and also do clinical research as well. And I'm a student right now in grad school at GW. I'm happy to be here. Thank you. Oh, one more thing I forgot. I'm also part of the HIV Vaccine Child Network with Dr. UB as well, working in the faith community to try to educate on HIV vaccine trials and bring in faith communities, especially of color.
Thank you, Khadijah and Dr. V. My name is Ulysses Burley. I am founder of UB The Cure, which is an organization that operates at the intersections of faith, health, and human rights with expertise in HIV and AIDS. I am an immunologist by primary training, but have done this work of health equity at the intersection of faith for almost 8 years now. I founded UB The Cure from my own experience as a clinician, realizing that we could not meet the full health needs of people in hospitals and laboratories alone, and that we needed to do more work addressing the upstream factors that made people sick. I'm also the project director of the HIV Vaccine Trials Network Faith Initiative, supported by the National Institutes of Allergy and Infectious Diseases. And as my sister Khadijah mentioned, along with her, I'm a co-founding member of National Faith HIV and AIDS Awareness Day, as well as the United States HIV and AIDS Faith Coalition. I came into this work as a student in the midst of my training. I was doing a one-year clinical fellowship in Buenos Aires, Argentina, working with their principal HIV and AIDS foundation, the Fundación Huésped. And it was at that time that I was exposed to the social determinants of health in a way that I had not been before, and realizing that things like racism and sexism and gender inequality and homophobia, transphobia, and religious stigmatization made people sick. And it was then that I realized that if I was going to truly help people heal, that I was going to have to do more for them than what we were doing at the bedside. And I actually found the best avenue for doing that was through my faith, my deep faith, which is a faith of health and healing. And so I have been down this rabbit hole now for quite some time. And I'm still excited to see where it might take us.
Thank you all. And so I'm going to ask us to go further down that rabbit hole, Ulysses and Dr. V and Khadijah. So talk to me a little bit more about what faith. We'll start with you, Ulysses, because you raised it. What faith and what's that journey been like? And why faith here? Why is it so important that faith institutions, faith organizations, people of faith engage around this issue?
Certainly. So I follow the teachings of Jesus Christ, but I also consider myself to be an interfaith, multi-faith person in my work. Particularly, the ministry of Jesus was one of healing. Its most predominant ministry was that of healing. And so the themes of health and wellness are really the most central points of any faith in any sacred text. And so it only makes sense to me that communities of faith are at the forefront of this conversation around a health issue, HIV and AIDS. To that end, Jesus Christ was also a social justice warrior. His ministry was not only a healing ministry, but it was a human rights ministry. It was a social justice ministry. And I believe that the HIV and AIDS epidemic of our time is a social justice issue, and that it disproportionately impacts people at the margins, the very people who Jesus sought to lift up. And so again, it only makes sense to me that faith communities are at the helm of a public health pandemic like HIV and AIDS that disproportionately impacts Black and brown people, that disproportionately impacts women and girls, that disproportionately impacts sexual and gender minorities. As you mentioned in your opening remarks, Fred, faith has sometimes been at odds with this issue of HIV and AIDS because of the intersections in places like sex and sexuality and identity. But I believe that because of the aforementioned faith's alignment with health, faith's alignment with wholeness, faith's alignment with social justice, that there's still space for faith to be beneficial in the movement to end HIV and AIDS. And I think that faith communities must be in the conversation at the table if we're going to end it as a public health crisis, particularly in people of color and more specifically in Black people in the South.
Thank you. Khadijah, thoughts on this?
I mean, I echo a lot of what Dr. UB has already said, but I'm Muslim. I was raised in the Islamic faith. And, you know, growing up, we didn't talk about sexual health. I was pulled from sex ed class when I was in 8th grade. So I kind of learned stuff growing up, like much older, like basically undergrad. But in our faith, like I mentioned, I started a nonprofit and it's called Rahma, and that means mercy. So in our faith, when we start every prayer, when we read our holy book, we say in the name of God, the most merciful and most gracious. So mercy is at the forefront of our religion. And if you don't have mercy or compassion towards people living with HIV or AIDS, then how are we living our religion as a Muslim? And our Prophet Muhammad, peace be upon him, he taught the concept of mercy. He also was social justice. He also was an advocate, you know, for good. So like we have to follow that example. And, you know, I've been in many Muslim communities, Black, white, South Asian, Arab. I've been in all these communities. But I mean, the facts speak, HIV/AIDS really has a really high impact in communities of color. So when I go in these communities, I really try my best to be supportive and provide accurate, up-to-date information on HIV and AIDS, actually, you know, language matters, things like that, and try to bring in religious texts. People are like, well, if you're following religion properly, you won't get HIV. Excuse me. So you have to break that down and get into all of that. And then, of course, you have to find out how to be more inclusive, too. I mean, people of all backgrounds, of all gender identity, sexual orientation, they come to a place of worship to find peace and to find God. So who are you to turn them away? So I try to work with them. You know, I also do interfaith stuff as well. I'm part of the Faith Coalition with Dr. Davie as well, if I can mention that. And we do work as well, Interfaith-wise. Because it's important to show that we are stronger together, not by ourselves, but together. So I find it's very important to do this work, and I use my faith as my my lead. And if I find myself not having mercy or compassion, I check myself and try to get together, and then, you know, come back and try to do this work.
Great. Thank you. Dr. V.
I actually don't know that I have much more to add to that, except to say that I'm a Hebrew Bible scholar, and part of my challenge in working around this is working with congregations oftentimes who want to look at the Christian and Hebrew scriptures around sexuality. And I often say to people, I'm really interested that people are more concerned about 6, maybe 7 texts that have to do with same gender encounters with sex, not even loving, same gender loving encounter, and ignoring those that may actually be same gender loving. That's a whole nother conversation. And ignore the 30,000 plus text on how to treat the poor. So so some of it is trying to address the way in our faith, I'm Christian, we disproportionately harp on, and I do mean harp on, sexuality as a quote cause, and therefore sin, and therefore anything that comes out of that, I'm putting all this in quotation marks, sin, as the cause of the illness, and therefore as judgment from God. And I think about people who said Katrina was a judgment on New Orleans, and the way people use this language. And so for me, I see my work as trying to disrupt this bad reading of Scripture and this bad reading of the God we serve. And also understanding Scripture to be more library and conversation than concretize, this is what you should do, blah, blah, blah. Because when people say things like, well, if the Bible doesn't say anything about it, then I don't have anything to say about it. And I'm like, well, then don't say anything about your car, because the Bible says nothing about your car. And imposing on the Bible things that the Bible does not say about anything. So I can hear Bishop Yvonne Flander of the Fellowship of Affirming Ministry saying, boil the water. They didn't know what leprosy came from. Now we know. So do the work that learning has brought us. Last thing I'll say about that is the proverb says that the beginning of wisdom, that knowledge is the beginning of wisdom. Not anything else, knowledge. So as we learn something and as it teaches us something and people say it's antithetical to the sacred text, it's like, no, because knowledge is the beginning of wisdom. We see through a glass dimly. We don't know everything we need to know. And that's why the sciences, what Dr. Ulysses is doing, is important. Because we're going to find out how to defeat not one virus, but other viruses, not one bacteria, but other bacteria, not one amoeba, but other, there are things they didn't know in the Iron Age that we now know, and knowledge is the beginning of wisdom.
Great, thank you so much. The churches, other faith institutions spend a lot of time, we as faith leaders spend a lot of time talking about other people's sexuality. Dr. V, you've hit on this. When we probably should spend more time talking about our own, trying to regulate other people's sexuality when we should be trying to regulate our own. And you're on college campuses. This work is being done through historically Black colleges and universities and Hispanic serving institutions in the South. What's the faith message about a healthy sexuality to some young person who's trying to navigate his or her, their lives, their existence, and while wanting to have a positive approach to human sexuality, while at the same time, wanting to be careful about how they engage, around sexuality. So what's the word? What's the faith word to these young people about how to navigate a healthy sexual experience? Khadijah, why don't we put you on the spot?
Of course you would. So I think it depends on where you go, what community you go to. They must be different. So I can't speak for every faith community, and I come from the lens of the Islamic community. So there are different environments, to be honest, different environments, depends where you go. But where I go and I try to send out, basically like within my work through Rahma, is that it's important to know, be educated. So like what we do, we've been in mosques, and, it's always a stigma talking about sex or gender. So you try to be creative. We'll go to like clinics that already have like a health fair or something. We'll go there and have a table, and we'll have like stuff in like discreet bags so people can grab it without like, people know what they're doing. Or we'll have like questions, or we'll talk to people directly that have questions. We partner with like, health, in churches called health ministries, but we have health programs. We partner with them and talk to them that way. But as far as engaging youth, a lot of them don't even come to the mosque. Like I've seen, they don't come to the mosque anymore, really, because a lot of times they don't feel that there is a message for them there. So it all depends on the environment. So we try to go to the youth. Like what we've done is we had a program called the Empower Program, that engaging Muslim peers to do outreach education resources. And it was led by college students at Howard. Most of them were at Howard University, HBCU. And what they did, they were creative. They came for like 8 weeks of training at Rahma, led by another peer educator that helped her and myself help the program together. And then they had like a talent show. And then there they did like a little flash mob. And the youth came and had fun. They won prizes. And we discussed topics that made it feel safe about in a faith environment. So I think we also went to the streets. I think it's important to like go to where the youth are, discuss topics that are important to them that might be stigmatized in the faith setting, unfortunately, and work with it. And then one thing you can do to bring you back to the faith setting is to talk to the leaders, the faith leaders, and make sure, a lot of times I don't feel like they know a lot of things, but sometimes when I have convos, their mindset's like back in the 80s. So okay, wait, no, we don't say that word anymore. Or no, that's not accurate. But you want to be respectful too, right? So you have to find a way to be respectful, talk about it, just have a conversation. And I will say that I've found that I've had some success with a lot of faith leaders in DC, New York, other places throughout the US, because, you have to come at it through a faith lens and, affirm the faith, of course, because that's their light and their lead, but then bring in other information to kind of make sure that you're inclusive and that you're able to reach people that might be hard to reach. So I think I answered the question. If I didn't, let me know.
Thank you. No, that's very helpful. Thank you. Ulysses, do you want to take a stab at this one? And then Dr. V, I have another question for you.
Sure. I'm not a theologian, and so I won't go as far as to speculate what the sacred text has to say about sexuality in the context of faith. I'll leave that to Dr. V. But in doing this work, I've learned a lot. I've gleaned a lot from persons who are theologians. Reverend Edwin Sanders, who I consider to be a mentor, always talks about our predisposition with the sexuality of others, as you mentioned, Fred. And he relates that to our own discomfort with our personal sexuality and how many of us haven't settled into our own sexuality. We could cure HIV and AIDS tomorrow, but the church and faith at large would still have an issue with sex and sexuality that would manifest in other ways. And not just same gender loving sex, but just sex, right? We don't even do a good job at talking about what healthy sexuality looks like between man and woman, married or otherwise. Also, I think it does a disservice to limit the perspective around sex and sexuality and faith to young people, as if to say that people over the age of 50 don't possess a sex or sexuality, especially if you look at the HIV and AIDS trends and understand that there are people who are being exposed to HIV and AIDS over the age of 50 because our sexual lifetime has been expanded because of biomedicine. We now have the first generation in the history of the HIV and AIDS pandemic over the age of 50. And so I think we all have to have this conversation across generations around what a healthy sexuality, what a healthy sex looks like in the context of faith. And that sex is something that God gave us. I think when we limit God to these boxes, that we minimize God, right? And I serve a big God, right? And I think God can handle our sex and our sexuality. God gave it to us. And so then I think that we should be able to have those conversations around those things. You know, we now have a whole generation of young people who are experiencing their first education around sex and sexuality from social media or from peers or at school, because their parents were never prepared to address sex and sexuality themselves. They're still not fully comfortable in their own sex and sexuality. And so then it trickles down generation to generation. And so I think that, you know, we have to have these conversations, sure, among young people who are coming into their sexual maturation, which comes with exploration and experimentation and sometimes high risk behavior. But we also have to acknowledge that, you know, they're adults and seniors even who are still exploring the fullness of their sex and sexuality in a time of HIV and AIDS, and don't have the proper tools to be able to navigate that. And as a result, we have, you know, an increase in transmission in people over the age of 50. And so, again, if faith at its core is about life and life abundantly, then sex and sexuality has to become a part of the conversation. If we know that there are diseases that exist that are transmitted via sex that might minimize abundant life. And again, I don't have the training to speculate what God has to say about sex and sexuality, but I know God has to say something about it. And so I'll leave that to Dr. V.
Sounds like you have some training there, Ulysses, and really appreciate that perspective. So, Dr. V, this epidemic has been going on for quite a while. We are here because of its impact on minority communities, particularly Black and Brown communities, quote unquote sexual minority communities. And we're here because of faith institutions and the intersection of faith institutions with this world. So with this phenomenon. So my question to you is, how have you seen these institutions change, generally speaking, over the life of the epidemic? And are there any specific changes that you've seen that you want to highlight or celebrate, or any surprises that you've seen that you want to share with the rest of with the audience on this webinar this morning?
Yeah, well, first of all, thank you both for those answers. Those were good answers. I would say, like I told you, I've been thinking about this since the 80s. You know, there are movements like the Fellowship of Affirming Ministry, where Bishop Yvette Flunn is the presiding prelate, and there are hundreds of churches, small, yes, where the predominant number of people are same gender loving or sexuality exploring. I'll say it that way. And so experiencing their Christian faith without the shame that comes with being stigmatized for being same gender loving. This has nothing to do with HIV/AIDS. But if you get to that, if you can get to a place where when I was pastoring in Austin in the 1990s, we used to, right before school start, we would have an age-appropriate day of celebration of one's sexuality, from small to under, and we would do this conversation around what is a boundary life, not, you know, and we would say to our young children, if somebody touches you and says, don't tell, that's the thing you tell. So we were trying to help them know what feels right, what doesn't feel right. We try to help them understand what grooming is, how somebody might give you candy and blah, blah, but it's always inappropriate for a coach to do this, or it's always inappropriate. So without shaming the child for feeling good for a sexual touch, because the other part of that is, from the Christian and Jewish perspective, everything God made is good. I can't speak to the Islamic perspective, but I presume that that is also an Islamic, is certainly a Buddhist perspective. Everything made is good. That includes your good feelings that come from deep connection in sexual reactions, right? So I think there have been churches and, certainly the UCC denomination that have embraced it. And there have been churches within denominations who really want to build the kind of community that is not shame-based, right? That to me is, I can see that as a progression. And there are denominations that have become more entrenched, where they shame people for it. I'm still stunned that there are churches in the South where if a young girl gets pregnant, she has to come to the front of the church and apologize to the church. The young man never has to come to the front of the church. So some of that is also misogyny, how you blame women for men feeling sexual, I just think that's work that we have to do in the church. And I'm saying church writ large, knowing that this is across a large swath of theological understandings, right? So when you say church, you're not talking about one thing, unfortunately. But I do think that there have been some headway in it, and even in the South, I think about Ray of Hope Baptist Church in Nashville, that is very active in trying to break down these barriers of shame around sexuality so that you can even have a productive conversation around HIV/AIDS.
Great. Thank you.
I also think we have to quit saying HIV/AIDS is a gay disease, but that's a whole nother part of the conversation.
Right. Thanks so much. Khadijah, anything within the progression within Islam that you've observed over the last, over the time that you've been engaged around these issues?
Progression surrounding,
yeah, sort of opening up of the conversation, any changes that you've seen, either in particular communities or more broadly when it comes to Islam and this issue?
Yeah, I've definitely seen more content, especially more young people. I think it's like, we're going to say what we have to say. So I think I've seen it more happening. And also I've seen it happening in the older population. I think we have several different groups that, you have progressive Muslims, Value Advocates Street that have a Muslim program there. We have faith leaders that are very inclusive. We have young people having conversations. We have different campaigns. I'm seeing it more and more. And I feel like I said before, I've seen a lot of youth leave the faith space, but I'm also seeing them coming back because now they're finding that, okay, I am welcome here. This is a place for me. So I will say that I've seen it. And also with my work through Rahma, we've been in places, diverse places talking about sex. And, you say sex is not a bad word. We all got here through sex. How is such a bad thing to talk about? So we had these conversations. And then, after we had these conversations, people come up to us you know what? We ain't talking about this growing up. I'm glad we're having conversations now. I think it's important. How can I get involved? And we want to hear that because we want to keep spreading the word and keep having conversations. So people want to get involved. That's the way to do it. But, for me, I work a lot with college students and young people. Because when I started this, I was a college student myself. So I kind of have connection to that age group. So, so it's easier with that population. But then we have people at Rahma that are 50 and over, and they reach their peers. And then we have people that, are in different age groups because it's important. People from different backgrounds. It's important. We have people on our board that, that identify with, LGBT community. So it's very important to have these diverse identities and people inclusive so that we can reach all people. Because Rahma is for everybody, and that's the goal we try to do. We try to portray. And of course, I've been called out a lot on things because I didn't know better. And I'm human. I've learned along the way things I shouldn't say, what I should not say, what I should not do. I got called out from the LGBT community a few times, that I had to learn different things as well. And it's important for me to be called out so I know how to do better. So, you know, I'm trying to do that. I'm trying to, you know, do things to show that. And I think, you know, as I travel through different parts of the domestic space here in the US, I'm seeing more and more conversations. And I think that's progress, because you go back years ago, decades ago, we didn't have the conversations. If we did, they were like far in between.
That's great. Thank you so much. Obviously, this is it's a campus-based approach to addressing this issue of destigmatization of HIV and AIDS from, again, a faith perspective. But we also have a lot of medical folks on this Zoom today, at least significant portion. So Ulysses, I'm going to ask you, as Dr. Burley, how should the medical community writ large, particularly in the South, think about engaging both the HBCUs, HSIs, as well as the faith communities that in many cases very much a part, if not the creators of these institutions, very much a part of the culture of these institutions? How should these medical institutions, medical professionals, just think generally about ways in which to engage to address this issue? And I know you spoke to some of that earlier, but if you could reflect on a little bit more.
Oh, well, I think first and foremost, the medical community has to acknowledge community as a part of the care continuum. And the faith community is a part of the community. You know, when I was a student in training, there were more than one time where I would be at the bedside of a patient, and that patient was living into their faith, talking about prayer and God having them and God being in control. And more times than once was the attending physician, the person who I was learning from, the person who I was training under, they would dismiss that person's faith. They would shame their faith. They would shun their faith. And it was dehumanizing for me, a person of faith. But I also understood the dichotomy sometimes that exists between science and faith. As a product of an HBCU that was largely founded by people of faith, an HBCU that has been at the forefront of producing some of the world's most famous biblical scholars. I think that in order to end the HIV and AIDS epidemic, we have to come from behind the laboratory bench. We have to leave the bedside, and we have to address the social determinants of health that make people sick. We have data that tells us that only about 20% of modifiable health outcomes are impacted in healthcare settings, hospitals and clinics. The other 80% happens in community, where people live, where people eat, where people worship, whether or not people have access to safe and affordable housing, or people are food secure, or have access to healthcare. Yet the funding doesn't match that, right? Most of the funding goes to what we do in healthcare and not what we do in a community. And so in terms of clinicians, healthcare providers wanting to be more engaged at college campuses, HBCUs, I think first and foremost, engaging those HBCUs that are associated with medical institutions, Meharry and the HBCUs that are present in Nashville, Morehouse School of Medicine, and is situated in the Atlanta University Center, which is, you know, a consortium of many HBCUs, Howard in Washington, D.C., and Charles Drew out west. That's a good first step in terms of engaging those communities. But, you know, also HBCUs produce a majority of this country's Black healthcare providers, right? And so those programs exist on campuses. I was a part of them from even before I went to college. I was a part of research programs at Morehouse College, which is my alma mater. And they groomed me, if you will, to be not only a scientist, but specifically to be a Black scientist to address the needs of Black people. I think one of the ways in which we get out of this epidemic, particularly as Black people, is we need more Black folks in healthcare who possess a level of not only cultural competency, but cultural humility, right? Competency is having an understanding of culture. Humility is actually appreciating and affirming one's culture. And we know also that the more people of color we have in healthcare, the better health outcomes that people of color have because of that. And so, yeah, there has to be a new thought around how it is that we deliver healthcare. It's not necessarily asking healthcare providers to do one more thing, because I acknowledge that they already have to do enough, especially in our current situation with COVID-19. But if our mandate really is to keep people well, and we know that what we do in hospitals and in clinics doesn't necessarily do that fully, then we have to tear up the model and write a new one, make a new one. And that model is integrated. That model implements intersectionality that Dr. Kimberly Crenshaw gave us. And that model has to include faith communities.
Great, thank you. Thank you so much. Khadijah, I noticed you unmuted. Did you want to come in
I wanted
here?
to add something, yes.
Sure.
So I work in a hospital in HIV prevention program. So I work with nurses and doctors and social workers, and we work with newborns up to age 24, so the youth. And, you know, we found, so we actually go into the community, go to high schools, do programs there in college campuses. And we found that young people, we know we have short attention spans. So we found that with professional medical, you can't go in and do a PowerPoint. You're not gonna listen. You have to do like something interactive and engaging. So what I've done is we create like games to kind of bring home the concept of PrEP and, you know, transmission and, you know, STI education. A lot of these kids come in with HIV and also with chlamydia and gonorrhea and HPV, all the different co-infections. So we have to make sure that we're able to educate them on this. And they come in it with like recurring, like they might get cleared up, it's like again with the same thing going on. So, you know, our goal is to educate them, not have no judgment, you know, create a safe space for them and encourage them to learn about this. And like when they learn, they're more proactive and, you know, making decisions that protect them from contracting different viruses. And then, you know, we are also working right now with GW on a research project with Black women living HIV and faith. That's our actual project right now. So I interviewed some women, and, you know, it's just some things we hear, like, you know, with doctor, a lot of them need cultural competency training or understanding about faith, because people are not going back to the doctors because they don't feel like they understand their faith background or their faith community. So I think it's important to have. And also, you know, people aren't just living with HIV. People are living with diabetes or, you know, heart disease. So they're more than just HIV. And doctors don't even ask about that sometimes, or ask them how they're doing. So they're like asking about other things going on with me. Like, I don't have just HIV, I have other things going on with me. And it's important, especially the AIDS population. I had someone talk about that recently. I think it's important that, and also I know doctors have like short time to see patients, and patients are like, I'm not going to come to you for you to talk to me kind of way. I'm not going to come to you till it's time for me to come forced to come get my prescription to renew it for my medication. So I don't have time for you to be in and out, treat me coldly, or not understand what's going on with me, or, you know, my issues. So I'd rather not come to you at all. And I've heard of some patients, some people that I'm interviewing recently. So I think we have to take things in mind, and also make sure we are mindful of the age group we're working with. Because again, young people have different needs than someone who might be from a different age group. So I just see networking here, and also to engage the community better. Like for me, I've reached out to different organizations here in DC area, and doing like one-on-one presentation with them about our work, what we're doing here, how we work together and collaborate. And they see, someone from the community, they're more receptive. So having someone from the community do the outreach is important than someone like, that might not be African American or someone of color, or knowing what's happening in the community, more receptive to kind of working with you and having you come out and like lead different events.
Excellent. Thank you so much. Thank you. Dr. V, I'm a young person on a college campus. I've got PrEP. I've got other ways to protect myself against these infections. Why should I be concerned about HIV, AIDS? Why is this such a big deal anymore? What else is going on here that if I'm a young person on a college campus, I need to be thinking about when it comes to me and my development?
Yeah. So Dr. Ulysses already alluded to this, which is to say, I'm going to say this. I'm trying to figure out how to say this. The time that we are most developing, our brain, our emotions, our whatever, is between 16 and 29 is the biggest brain development. So I remember as a pastor saying, yeah, you don't know what you don't know when you're 25. Like I was in the ministry, and God help anybody for the sermons I preached from the time I was 18 until I was 30. I mean, what did I know? I mean, what I'm saying, I felt called, and I affirm that. I affirm that for anyone. But I think the biggest thing is to have the kind of mentors that will help you without shame address your growing, and help you sort of be aware of where you are. Our kids don't suffer from a lack of knowledge. Although misinformation is a problem on the web, you can actually find out anything you want to know, right? What they often lack is inspiration and mentorships and guidance, people who will walk with them through. I used to say to my kids when they were young, there's nothing you can't tell me. You can't shock me. And I promise you, I think they were trying from time to time to see if that were true. They would tell me things, and I would be like, oh, okay, they're in their 40s now, and they laugh about that. They think that's funny that they used to test me about those things. But kids need those kinds of people, those kinds of adults. Young people need those kinds of adults in their life who can kind of help them test their own hypotheses about things, not tell them what to do, but help them think through and judge their own thinking. And come to their own, yeah, no, that's not a good idea. Or, okay, if I'm going to do this, then I need to do, whatever. I see that in, I don't know, popular TV, This Is Us right now. That's one of the big storylines. And I just thought, well, now this is a good way to tell this story, of these two young people trying to manage their own sexual lives, and whether or not they're mature enough for it, and all of that. If you believe that God is love, and therefore love is God, then telling young people they don't know what love is a futile way to get at this. It is really helping them judge their own maturity, not you judging their maturity, but helping them set in place some guardrails, some guidelines and whatever. It doesn't mean that you're not going to make mistakes. It also means testifying. We overcome by the word of our testimony, telling young folk the truth, telling them our own stories, our own missteps, our own triumphs, the places where we had doubt, the places where our own faith from our perspective failed us, the places where we reintroduced ourselves to God, in the midst of struggling around whatever it is that we're struggling around. We're talking about HIV, AIDS, and sexuality and sexual identity, but literally kids need somebody in their lives that they can sort of test their hypotheses with. And I think if the church is going to do anything that would help, it would be to build that kind of community. I grew up in a world where it was never expected that my parents would be the only people speaking into my life. There was always a community of other adults, aunties and uncles who were not actually aunties and uncles, but people who I could ask the most outrageous thing to and get answers from. And I think that the church can help in that regard. And I'll say this and be through. I think part of what we do at Woman Preachers, try to help preachers find the voice that will help create those kinds of communities where people feel safe enough to ask the questions they need to ask, to test the hypotheses they need to test, to question their faith. I will say this may sound crass, but I say this all the time, to not just the kids, but to everyone. God has broad shoulders, big tits, can take anything, can take our doubts, can take our questions, can take our fears, can take our yelling, can take all of that. The God who cannot take that is no God.
Amen. Amen. So I'm going to ask both Khadijah and Ulysses if you want to have a final word for 2 minutes, and then I'll close us out with some final comments. Khadijah first.
Just, I guess, thank you for having me on the panel and having this conversation, especially on this Awareness Day. I think it's important. Like I said, I work with young people, and it's just when they get diagnosed, it's very hard. It's very hard for anyone, but especially young people, I feel it's very hard in trying to help them navigate their status and, next steps and everything, can be challenging for them. And sometimes we deny from even their parents and their family, they're keeping their children back. It's just so many different things. So I think it's important to have conversations, continue to talk to youth, go to campuses. People are getting diagnosed in college, we're getting diagnosed in high school, people are born, with HIV. So it's important that we have these conversations, have the resources, have the health professionals, have the advocates, have the faith leaders, think about it in the mosques, the churches, synagogues, wherever you can, because people need to know, this is something that affects all of us. It doesn't matter if you're part of a faith community or not, it still affects all of us. So we need to start, get the veil from over our eyes, have discussions in our communities, call out faith leaders if they don't want to talk about it, or they're saying things that are ignorant or stigmatizing, and create safe spaces. So that's my goal in life with the work that I do. So hopefully it makes some type of difference. But thank you again for having this conversation. Hopefully it's helpful to whoever listening to the event.
Thank you. Ulysses.
Thank you. I'd be remiss in this Black History Month and on this National Black HIV and AIDS Awareness Day not to lift up really the driving force of HIV and AIDS in the South today, and that's systemic racism. We talk a lot about sex and sexuality and the intersection of gender inequality and the systems of oppression that are in place to marginalize those groups of people. But really at the core of the epidemic here in the United States and really around the world is racism. And the church, at the very beginning of this country's history, was the chief proponent of fighting systemic racism from slavery and throughout Jim Crow and the Civil Rights era, and separate but equal, and now in a time of Black Lives Matter. HIV and AIDS is a Black Lives Matter issue. Is an issue that is disproportionately impacting Black and brown people, not because melanin makes us more predisposed to infection, but because melanin makes us more predisposed to discrimination and oppression. And until we address the racism that exists, not only in this country, but in our healthcare system, and also in our faith spaces, then we will not address the issue of HIV and AIDS in this country, and particularly in the South. And so if for no other reason, the church and other faith institutions have to be at the forefront of this work, because this work is at its root about discrimination, it's about oppression, it's about subjugation, and faith, at least good faiths, are about liberation. If your faith is being used to bring people down and to hurt people, then that's not faith. Faith is about liberation, and it's about freedom. And currently, Black people are under oppression in this country as a result of our skin to diseases like HIV and AIDS and COVID-19 and hypertension and diabetes and fill in the blank. And so if you can't get past the hard questions and conversations around sex and sexuality, if you can't get past the questions around gender and identity, certainly you can continue to do the work that we've always done around racism to make sure that Black people and brown people aren't disproportionately impacted by HIV for no other reason than the skin that we inhabit. And so I hope that that would be a prevailing message on this National Black HIV and AIDS Awareness Day throughout this Black History Month and throughout this time of Black Lives Matter.
Thank you so much. And let me just,
can I just say,
go ahead. Sure, absolutely.
Well. That's all. I just want to say thank you for the opportunity to be in this conversation and to meet Khadijah and Dr. Ulysses.
Great, thank you. And I want to say the nation is very lucky to have each one of you. I'm inspired. You've given me more hope as a result of these conversations. I've known of Dr. V as a theologian over the years. It's been great to meet and hear from Khadijah and Ulysses. And really, you represent not only just a spark of hope for the country, but you represent sort of substantively what it means to approach these issues in an enlightened way. And that's really encouraging to me, and I think to the rest of the nation. And we need to do more of these conversations so that the nation can have access to all that you bring to this issue. Let me thank my colleagues at IFYC, particularly the founder and executive director of IFYC, Ibu Patel, but the three people who are primarily responsible for this work, Dr. Janet Cordovas, the Reverend Don Abram, and Noah Nakau, all of whom work on a daily basis with Wake Forest University Divinity School and the Gilead Compass folks on this very important work, and all the HBCUs that are involved as partners in this work as well.